want to start, Holly, with something actually related to some of your PhD research, is the challenges of nursing today, especially with burnout. We've got massive shortages. We have huge number of nurses leaving the profession really early in the career, and overwhelming post-COVID a sense of burnout. And then they're facing huge retirements. They're facing seniors that are growing, and so we're having more and more acute patients. So this is the situation of nursing. And then we see equal challenges inside of hospitals. Tiffany, maybe you want to cover what we were seeing when we talk to hospitals.
Yeah, well, here are the challenges we hear when we do talk to hospitals, and it's often the short staff, the staffing shortages both in nursing, in CNAs, and kind of every area really, and then a lot of the higher acuity of patients. We're hearing that time and time again, and that the nurses are having to take care of sicker patients with the same type of resources. And Holly, how much of this have you been through in your time, last 40 plus years in the profession, and how much do you see of this as new, and how much of this do we just have transparency on the problem that we have always had?
Well, honestly, there's been evolutions of every one of these challenges that I've had exposure to. Staff shortages aren't new. It's just that we're much more comfortable talking about them and really allowing the voices of the nurses to help us manage each of these situations here. The one new thing that has really just started to evolve over the last 18 months, 2 years, and become very prominent, and one that's strategically important to organizations, is that opportunity for how we as leaders or people even in the IT industry can help with nurses feeling safe at work. What we can do from a violence prevention or violence awareness that can really change the work environment for nurses. I'm going to tell you, when you think of staff shortages, nurses have always looked at this as, I need to feel that my workload is manageable every day, whatever I'm doing. So there's different ways to manage that. And technology has been primary for that in the last, more than a decade. And what we, as people who are looking at how to solve this or even address this, really need to link every strategy that we're doing for what challenge we're really addressing with that. Because I think people and anyone in healthcare sometimes really just needs to be able to connect what's actually happening from a strategic standpoint into what they need from a work-life balance and managing the challenges that you've really done a nice job of highlighting.
Holly, do you think that in your career, let's focus on when you were a nursing leader, do you think the voice of nurses in technology decisions for the hospital is the same, has increased? I think it clearly increased after COVID because of the travel nursing surges, but go to pre-COVID. Do you feel like it was a gradual increase, or do you feel like it was still outside looking in to kind of push for technology change that actually helped nurses?
Well, I think nurses have always been an integral part of that. And when I think of when most people were building electronic health records, it was all about, let's not force the e-record to fall into how we do this in current workflow. But there was a lot of study that went in, and really self-awareness of what the workflow was and how technology could really advance that. So I think that without listening to the nurse, you're going to be so much further in anything that you use to adopt, whether it's with technology or even processes. So I think that's always been a part. I think some people are just more attuned to listening to that.